Welcome to Alma's podcast. This is the perfect place to discuss developments in the world of medical and aesthetic treatments. My name is Eyal Shapira, and I'm a clinical applications specialist here at Alma. I would like to invite you to join us and dive deep into the surgical, medical aesthetics, and beauty markets and discuss the cutting-edge technologies they hold. Make sure to visit our website at almalasers.com, where you can subscribe to the show on iTunes, Spotify, YouTube, or via RSS, so you'll never miss a show. Also, don't forget to follow Alma Lasers International on social media as we share the latest updates and trends for 2021. It's the perfect forum to discuss and learn about our leading product. Today, we are thrilled to embark on our podcast journey with our very first episode. We were delighted to host live Dr. Eyal Shapira and Dr. Hadar Israeli, two leading plastic surgeons from Israel with vast experience with our Beautifill platform. They shared with us their user experiences, knowledge, and recommendations regarding different aspects of the system. So hop on and enjoy the ride.
Welcome all to Alma Live Studio Show. This is the first time Alma is broadcasting a live expert panel throughout the world. I'm so excited to be here, and I'm so excited to see so many people around the globe in our audience. I am Amit Lavi. I'm the surgical director of Alma. I'll be your host today, and we're very happy and delighted to host two amazing plastic surgeons, leading plastic surgeons in Israel, Dr. Eyal Shapira and Dr. Hadar Israeli. Hello.
Hi.
Hi.
They will share with us their knowledge, experience, and of course, their practice. So in this interactive activity and event, please, we have a chat. You can share your thoughts, your ideas, and of course, any questions that you have, and we will address them during this event. So in this event, of course, I would like, of course, to address you and thank you for coming here today. I appreciate your time, and I would like to start with a small question. It's kind of a broad question about the fat, some trends. We see that with all the Kardashian family going around, leading trends in the US, in the world, of course, and we see that there is reductions in the number of people that are putting breast implants, and we see some regenerative medicines with fat. So what are your thoughts concerning the future of fat harvesting and fat grafting?
Oh, that's a very, very good question. I think that the more natural the material we put in the body, and the more it will be easy to use it, like the fat, we will see the exiting of the silicone implants outside our currently practice. I guess that the fat, if we can use it very nice, very smoothly, very natural feeling, it will be a very, very good choice for those who doesn't want to have this silicone implant, and for surgeons as well. Yeah.
Dr. Shapira?
Yeah, so first of all, it's my pleasure to be here, and I'm very happy for this opportunity to share my thoughts and also to hear your opinions, and we would like you to write it and comment on our remarks. So my opinion is that fat is a great material or a great substance for reconstruction and aesthetic uses due to the fact that it is natural. Of course, we use the fat of the same person itself, and we have a vast procedures that we can use fat to reach our goals. So Dr. Israeli mentioned the implants. Of course, fat has advantage just from the fact that it's your own natural tissue versus a silicone implant. In the last 2 years, we had this storm of worry due to ALCL cancer, due to implants that have texture, rough texture, and the whole issue of safety using implants re-emerged to our world. after 2 decades that we use implants quite vastly. There is a challenge using fat because we are talking about an implantation of tissue into the body, and the biggest challenge is to keep those cells that we have injected alive and hopefully will survive the procedure and will take into the tissue, resulting in the end point that we want to reach. This is a challenge, and actually this is why we are here. We are here to talk about this challenge.
It's quite a challenge. I totally agree with both of you. And I guess that the future is, I don't know the years, but the trend is going on. I totally agree.
Absolutely.
Yeah.
Yeah. And
Also in facial procedures.
yep.
Yeah.
I see more and more patients that asking to put on their own fat instead of the fillers, instead of hyaluronic acid, the silicone, the radius, everything. They would like it to be their own tissue.
So it feels more natural
Yeah.
to the body.
And safer.
And safer.
Yep.
And you have also the advantage of rejuvenation. When you put your own tissue, the stem cells have some rejuvenation characters, so it makes the skin more smoothly, more nice, more natural, and shiny also.
Yep.
So it's kind of an added value that other substances do not have when you're using the fat.
Yeah. Absolutely.
So I think that this is a growing trend that we're going to see, I think, in the near future. I'm not talking about 20, 30 years, but within the next 1-2 years from now.
Yeah.
So in your opinion, I would like you to maybe share a little bit to our audience what, in your opinion, your key advantages using the Beautifill system.
So prior to my acquaintance with the Beautifill system, I did, like most of you, I think, I did mechanical liposuction. And one of the drawbacks of this method, whether it is a mechanical by hand liposuction or a machine-assisted liposuction, the main disadvantage is damage to a lot of the cells that are taken out. So when we look at the substrate that we get in the canister, the amount of damaged cells is quite large. The first thing that I liked about the Beautifill system is the fact that the amount of cells that are damaged is much, much lower. And we have proven that in several experiments that we have done and published also. Obviously, when you do a tissue implantation, the more cells you have, statistically, more cells will take. So if you have a solution which has higher number of cells, most probably you will reach your goal easily. It's not only the fat itself, it's also the technique of the reintroduction of the cells back into the body, but the starting point, which has a substrate that has a lot of cells, is a good starting point. And this is one of the major advantages of the Beautifill system.
Yes, I agree with him. It's very important also for the result, because when the taken rates is higher, we get a higher symmetry. For example, it's very important in a reconstruction of breast, in breast augmentation, also for facial rejuvenation. It's very important that you have higher symmetry.
Yeah, buttock augmentation.
Butt augmentation as well. And I find it's very important also in thin person, because in thin person, you cannot do repeated liposuction. You don't have enough tissue to take, enough fat. So in those, every adipocyte we're taking out, if we can spare its vitality, it's very important. So we can do one treatment, and we get equivalent result like in other techniques, which can take in 2 or 3 treatments. So it's very important, this anecdote of vitality. I also would like to say that I really like the fact this energy delivered by this diode laser makes it very, very easy manually liposuct the tissue, because it breaks the connective tissue and it easily goes through the tissue and out. Less muscles work. For me, it's very important. I prefer to work in the gym, not in the operation room. And also, it's reduced the complication like bruising, ecchymosis, since the energy delivers cause less trauma to this tissue surrounded. And of course, the huge advantage of skin shrinkage afterwards, which give a smooth skin surface afterwards, less irregularities. So the whole system, from the way you liposuction the fat until you transfer it, it's more easier for me, and I prefer this technique a lot, yes.
Yeah. So we see, first of all, thank you. It's quite interesting what you said. It's because it's not only giving you more fat, what you're saying, it's giving you a higher cell yield, and it's giving you also the tightening, and also it's making it easier for you to work. So would you say, or at least what do you think about the Beautifill as giving you the next step, or the advantage, or it puts you compared to other technologies? Because I know that you have so much experience with even other technologies. So in what procedure would you say that it gives you the right mindset to use specifically the Beautifill? I mean, are you using it for all cases, or in some cases you would prefer, to take the Beautifill because this will be the best option? So actually, from I look at the system from different point of views. So first of all, from the marketing point of view, the word laser has a lot of meaning, and the customers that come to my clinic, they search for those technologies that include lasers, whether it is facial skin rejuvenation, whether it is body skin rejuvenations, and whether it is liposuction, which is laser assisted, like the Lipofill system. And for my practice and my clinic, actually, the fact that the word laser is over there from the marketing point of view is very important. And we all work hard to make a living, and absolutely this is an advantage. Besides that, it's not only the word itself. There is actually, from my point of view, there is an added benefit for this added technology to the classical liposuction. As Dr. Israeli said, the advantage of much less working force that I have to invest in the surgery itself, it is easier to do the liposuction. And of course, from my experience working without laser and working with other systems, the skin tightening is very, very impressive when I compare it to other techniques. And the fact that I have less irregularities, and the fact that I can take bigger case that I wouldn't take priorly before I met this system. I had patients that I said no, because I was afraid they will have skin laxity. And now in my practice, I take bigger and bigger cases, which allows me, again, to sell more surgeries with high patients. They are very happy with the results. And that was a process of learning
how far can I push the envelope, actually.
Yeah.
So high satisfaction, which is, of course, important for everyone.
Absolutely. Dr. Eyal?
I also agree with all what he said, and I found it very, very unique, which previously I couldn't operate them because of skin redundancy that I thought it would remain afterwards. It's very, very useful in abdomen fat. Previously, I thought that these cases should go to abdominoplasty, and now we can use it. Mm-hmm. And also, in a very specific way, I think we're going to talk about it a bit later today, in the neck. Mm-hmm. There are some patients with huge neck, fatty neck, that previously I could offer only a facelift, and today I found it very useful with taking this all fat out and shrinkage of the skin, and with quite good results, and they are very happy to go for a small procedure, not this huge facelift, not with the scars, not with the recovery. Perfect. I will talk about it later.
It's very important. I think what you said, both of you, it's very important to understand that, first of all, results are so important because, people that usually go for surgery, if it's general surgery or gynecology or something like that, sometimes it's the result, the end point is not aesthetic, but for patients that are coming to your clinics, results by how it looks, it's so important, and therefore the tightening, what both of you said, and the option to operate on bigger cases should be very important to patients as well.
Yeah, absolutely.
So on that matter, my question, Dr. Shapira, so you talked about the high cell yield. So can you explain a little bit more how and why is it imperative to get higher viability, or the best viability you can have? And can it influence in some way on the survival rate of the fat?
So from my point of view, the main advantage is the laser fiber itself. The tip of the fiber has a prisma that breaks down the beam, the laser beam, in a 30 degrees angle. Mm-hmm. So again, from the economic point of view, you reduce your surgery time, and surgery time is money. So you do both things simultaneously. This is a great advantage. And to answer your question specifically about the survival of the fat, the absorption of the laser is in water. So the chromophobe that we are aiming to heat up is water. And this fact have changed my practice a little bit when I do the surgery. So in the past, I used to infuse the tumescent solution into the tissue and wait quite a lot in order for the water to be absorbed. And now I don't wait as much as I used to. I introduce the fluid into the tissue, and I start the procedure immediately.
After you're moving from one side to the other.
Yeah, mm-hmm. And I want to start it as early as possible because I want the water to be in the connective tissue. Mm-hmm. And when I do that, when the water are absorbed only in the connective tissue and the fat cells are not swollen up and mm-hmm. contain water, actually most of the energy is absorbed in the connective tissue itself. Uh-huh. We break down the skeleton that holds the fat cells without or with less damage to the fat cells themselves. And from that point of view, we get much higher percentage of viable fat cells because we don't really heat them up. We heat the connective tissue just besides it.
Mm-hmm. So do you have any secrets or at least protocols or recommendation in order to our audience to get the best fat or the higher viability of the fat they're grafting?
Yeah, I think that when I learned in my residency how to do liposuction, I was taught to infuse 1-to-1 or even higher amount of fluids versus the amount that I want to take out. And nowadays, due to the fact that I want the water to catch the water when they are in the connective tissue and not in the fat cells, actually I infuse less than what I plan to take out. And like I said, I don't wait. So I infuse, it is in the connective tissue, and I immediately start the procedure.
Okay, and this...
Do you use in the tumescent other things than saline, like hexachlorone, like lidocaine? Do you think that it cause has any influence on the vitality of the cells?
This is a question that we see in the literature. This is a subject that we deal with a lot. Basically, I don't have evidence-based opinion. I do what is done usually. I use the classic Klein solution, which means that the solution has saline with lidocaine and adrenaline. Sometimes I add bicarbonate if the patient is awake and we do an office procedure. In order for the infusion to be less painful, then I add bicarbonate. So it still works for me. So I don't have any evidence-based answer to that question that we all ask ourselves, and there are many publications about that. I just do what is common.
Yeah, me too.
Yeah.
Me too, actually. Even when I'm transferring the fat, I'm doing the same tumescent.
Yeah.
Yeah.
The same one.
Yeah.
So you didn't change any ratio.
Yep.
Yeah.
And so regarding that, by the way, Dr. Israeli, a question for you is what are the main uses that you use usually when you graft? I mean, people tend to think that, okay, you take the fat, usually it's the face, but what are the main usage that using the fat?
Usually I do it for breast augmentations or reconstruction. I guess that one of the main advantages that I see is because the vitality rate is higher, so there is less lumps afterwards in the tissue. Because when you put some fat in the tissue and it's not taken, usually it causes fat necrosis, and afterwards it's causing the tissue some lumps, calcifications of the fat, which you feel underneath the skin, and it's not very nice feeling for women.
Immediately, usually you see that, or
it takes time?
It can happen, but it takes 3 to 4 months afterwards.
Wow.
And those lumps underneath the skin, you usually can't take them out. So I think that high vitality rate and of course prompt technique of how you give back the fat to the tissue, it's very important. And sometimes it can prevent it or even make this inconvenience less happening.
So what are the recommendations for a successful transfer in the end? I mean, are there any guidelines that you think that are good?
First of all, I use a very small syringe when I'm bringing the tissue back.
For all parts of the body, or just specific to the face, or will you use a different?
For the face, I usually put in 1 or 2 cc. In the breast, I'm using a little bit bigger. It could be 10 or 20 cc. And I'm doing it with a drawback technique. I put little drops in every place I'm putting it back. In a lot of levels.
A lot of levels? I mean, not a specific layer?
A lot of levels in the breast tissue. So I can have a smooth and a nice appearance. I believe that for good taken, it should be surrounded with the vital tissue of the natural body. So I try to spread it all over.
Around,
Any parts in the body that don't like fat, or, I mean, because it's not only face and breast, sometimes, of course, it's the buttocks, or so different recommendations usually, or when you meet the patient, by the way, do you explain them the differences and what they need to anticipate I mean, this is something that they need to know before.
Of course.
I think that the explanation prior to surgery is important in every surgery. There is no difference in the liposuction and reintroduction of fat into the body. Expectations should be made realistic, and this is not different from any other procedure. I can tell you that in my practice, I am using more and more fat in other parts of the body, from the classical parts of the body. The face, the breast, and the buttock are the main areas. But in my practice, I do a lot of fat introduction into the labia majora. Older women that lose volume in that area, they want to rejuvenate the feminine area. And fat is one of the best tools that I have in my practice, and I do that a lot. Also, the fact that we have a high yield fat helps me when I have problems. So the more you do, you will have complications. And of course, we are not saying here that Lipofill is a problem-free system. There's no such thing.
Absolutely.
But at the same time, it helps me a lot. So when I see irregularities, or when I see problems like sunken areas a little bit, actually I use the Lipofill again, I take some fat, and I solve the problem quite easily. Usually when I do a second look or touch-ups, then they will be procedures that I will do in my office, which means office procedures, local anesthesia, and the fact that we have high-yield fat substrate, and hopefully, and mostly it does happen, a high take, it is quite easy to deal with problems like irregularities that you still see in everyday practice.
Absolutely. And the fact is that the canister is, it's a tissue separating canister, so you don't have to wait time for getting the fat out. Is it helpful for you? I mean,
Very helpful, yes, of course.
And you're actually taking immediately the fat out from the canister, right? I mean, we see the canister here, but you just take it out, or you don't need to wash it or centrifuge anymore. So the time consuming is also kind of helpful for both of you for the successful transfer.
Yes, I found it very nice and easy to operate with this nice canister. It separates the fat from the other tissue and the fluids around the serum. We can take it out very easily and put it in the syringe to redistribute it in the body. And since it's a closed, sterile system, no contamination,
no risks.
Yeah, no need to wash it, no need to put on some iodine or polydyne. It's very, very nice and easy to operate in my hands.
Yeah, you touched a very important point regarding the safety issues, and I know that both of you have a great, immense, actually, experience with breast reconstruction. Yeah. And women after breast cancer, of course, they had chemo, and so the question is, do you actually change protocols for these women, and do you have different guidelines for these procedures with the women when you're doing breast reconstruction compared to, let's say, facial rejuvenation?
Radiation cause damage to the skin.
Yep.
And this skin is very, very, very difficult to expand. So what I do many times is use fat grafting as tissue remodeling material. I mean, I put in the first procedure a little fat that which I use for helping restore the skin. And just
the laxity?
The laxity, the elasticity of it, even the texture and the feeling of it. So it will be not so tight as before. And in the second procedure, I can put some more fat. So in this case, I use it, all the substance of the stem cells that we use in the tissue as remodeling, and then I can use for expansion.
So it's kind of a two-stage or three-stage procedure?
Sometimes, yes.
Sometimes even three?
Yeah. Mm-hmm. Sometimes.
Regarding the question that you asked, from my point of view, if we talk about the canister itself, so the fact that it separates the fat from the fluid during the liposuction itself, again, I'm sorry that I'm going back there all the time, but it is time-consuming and
Absolutely.
surgery time. When you have shorter surgeries, then you save money.
Especially in the private sector.
Especially in the private sector.
Absolutely.
And also another nice feature in this canister is the fact that you can, no matter what is your practice, whether you do a closed system introduction of the fat cells back into the body or an open system, no matter what is your practice, you can do them both with this canister. So you're not limited to a specific practice, and it is quite versatile from that point of view. Regarding the breast reconstruction surgeries, I think that it changed. I work in a public hospital in my during the days, a public service. We do there a lot of breast reconstruction as well, and I think that the fact that we can have a variety of procedure from the point of view of how much fat you want to introduce helps us a lot, because we can treat nice reconstructed women but they may have some ripplings, very gentle ripplings, and but with the introduction of fat under the skin and just above the implant, we can improve those little things that may be annoying for a woman who had breast reconstruction, but you can do that also in aesthetic indication. So if you have a patient that had a breast enlargement with silicone implants and she has some ripplings, so the injection of fat under the skin and above the implant improves a lot the ripplings. So
do you see these ripplings occasionally, or it's common?
Yeah, it's more common than we think. Most of the women, they don't care about it, but those that it disturbs them, then you have a solution. And if we go up the scale, if a woman had just a lumpectomy and she has a specific area which is sunken, then you can introduce a volume in order to fill up this defect. And usually women who has lumpectomy get radiation, like Dr. Israeli said, and we know that fat cells improve skin texture, skin that was damaged from the radiation, and of course filling up breasts, so women that want to remove implants and want to substitute it with fat. Again, these are larger amount of fat introduction into the body. This system makes it possible. So the variety of procedures that we can use this system has actually allowed me to offer more procedures to different type of patients.
Your basket of tools just broadened up.
Absolutely, yeah.
So from a challenging tissue to another challenging tissue is the neck. And Dr. Israeli, I know that you have vast experience with the neck as well. I've been to many procedures to see that in your clinic. And so a question is, what are your recommendations for the neck? Because I know you have great results. And do you have any recommendation to doctors how to address the neck, points of entry? And do you actually change during the procedure? Do you change the cannulas? Because we have the 3 millimeter for the lipo and the tightening, and we have the 2 millimeter for just the tightening. So what are your recommendations here?
Okay, so it depends, of course, on the fatty neck. If it's a huge fatty neck with a lot of skin excess, I would use both. I usually use, first of all, the 3 millimeters, and I do the liposuction. And we were talking about it before, but I will mention it now, the radial beam,
the radial fiber,
beam
yes,
of the laser helps me twice. First of all, I'm using it for taking out the tissue and breaking it, and second, it's simultaneously shrinking the skin. So it helps me to do smooth movement all over the tissue and takes out the tissue very smoothly without regularity underneath the skin. And usually, in a fatty neck, it's enough. But if the skin is very, very, very thin, usually I have to do another procedure with the 2 millimeters, only for tightening. And there are some women that comes with loose neck without a prominent fatty tissue over there. So in those cases, we can use the 2 millimeters only. It takes out gently the extra fat that is in the tissue, and still we have a very, very good results. I just want to say that there are some women with very, very fatty neck and a lot of skin excess, which we use this procedure instead of facelift. In those, we can still see a bit of regularities under the chin here because of the excess of skin. And in those cases, we can still prevent the other procedure of facelift by using other technologies of skin shrinking afterwards.
Okay, so what is these methods that you're talking about, the tightening methods afterwards? So you go more superficially or?
After the procedure, there will remain a bit irregularity of the skin.
Yeah.
So I use it with pixel laser.
So you're also using the CO2 as well.
Yeah.
So it's kind of like a combining treatment. Yeah, I know the both of you are using the CO2 as well sometimes for more. Wow. So I didn't think about it. It's kind of like a combination of treatments that you can offer for your patients as well.
I have a question, if I may.
I'm not doing it in the
Dr.
same
Israeli.
procedure, just afterwards, because I want to see how the tissue reacts.
The healing.
It's not immediate procedure.
Not immediately.
Yeah.
It's a different procedure. Sometimes couple of treatments, but under Emma, like lidocaine
Cream. Yeah.
lidocaine cream.
So I have a question for you. When you do the neck procedure, do you use the 600 nanometer fiber or the 400 nanometer fiber? And what is the intensity on the machine that you use usually?
Usually I use the 400.
The 400 micron?
So the finer fiber.
And I use usually energy between 9 to 12, not more than that.
In the neck, 9 to 12?
Yes, because heating of the nerves in this area can produce the pseudomarginal mandibular syndrome.
Yeah.
So it will resolve finally after 3 or 4 months, but I wish there will be no heating of the nerves over there, and it's quite good results. And also, I usually put no more than 4 kilojoule per procedure.
Per procedure.
Up to 4 kilojoules.
Yeah, so this is my experience as well. So if we can give a tip here to our audience, usually when I do body liposuction, I use the 600 micrometer fiber, the bigger one, and usually the
In a 4 millimeter cannula.
In a 4 millimeter, or it depends, but yes, and the energy on the machine will be immediately 15. So this is
the top.
This is I go all the way up and I use it. This is my my choice, my first choice. But when you do the neck, you have to be more careful. And I use the finer fiber, the 400 nanometer fiber, and I reduce the intensity to around 10, 11. So it's the same area that you use. So yeah.
So regarding all of that, my question is, it's the contour defect that you also are rippling and think that now Dr. Israeli mentioned that there is some irregularity. So what are your recommendations and how do you treat or let's say prevent from these defects to happen? And the contour defects are for sure a problem for the patient. So what are your methods? CO2 is great, by the way. I think it's a wonderful option.
In my opinion, the first thing to do is prevent it. A meticulous technique is very important here to see that all the liposucted area is in one level and no lumps remained underneath the skin. Second, I put on all my patients a bandage for the neck.
For how many days, weeks?
I ask them for 1 week, 24 hours a day, and then to continue only at night. And I ask them every day before they put it to do a little bit massage.
Okay.
Massage it to all this area so the skin will not shrink while it's
irregular or
folded, like
folded,
under folding, yes.
Yes.
So it will be a smooth area. And afterwards, I usually ask them to do a lymphatic massage. So you take it all over and it makes a smooth appearance, yes.
But then they can do that at home during the massage, and this doing great result. We've seen, the audience, of course, are seeing some pictures of before and after of both of you, so that's kind of a deal. So on my part, at least, it was, these were my questions that were coming in my mind, but I'm just one person, and I wanted to know if there are there any questions from the audience, because I'm sure that the audience has much more questions than me, and we have some kind of time limit. So, thank you. Great. So, well, we have 4 questions.
Okay.
It will be addressed for both of you. How long will it last if fat has been transferred to the breath? So, how long the fat will last, or, I mean, they're talking about probably the survival rate.
Yeah, the survival, yeah. So again, from my experience, when I explain the patient the procedure, I first of all explain what we are doing, because many of the patients, they come and they ask for fat injection. And I explain to them that yes, the technique itself is to inject the fat. But actually, we're not doing an injection. So unlike hyaluronic acid, that we take a syringe and we inject it into the tissue, here we are talking about a transplant of a living tissue. And you have to explain this thing and to be clear about it. Because the fact that you do a transplant of a live tissue means that it will behave differently when you use a material like hyaluronic acid.
Which is not natural.
Well, not the fact that it's not natural, but the natural history of the procedure post-op, what the patient will see during the first period of time, the medium time, and the longer period of time, is different. It's totally different. And I explain my patients, and I divide the healing time to 3 periods. So the first period is immediately post-op, in which you have a lot of swelling and edema in the tissue. And actually, if the patient look at the mirror, he doesn't see the result, or she doesn't see the result. And if you don't explain it from the beginning, it might be stressful, because the patient that just had the procedure, maybe general anesthesia and pain, hematomas, and he looks in the mirror and he looks at himself and he or she sees, what happened here? Nothing changed. So you have to explain that you won't see the result in the first period of time. The second period is, or the medium period of time, is the time in which the swelling goes down. The skin didn't tighten up as much as it can, but we start to see the result. We see the change, but it is still not the end point that we want to be in. And the end point is the fact that when you introduce fat, there is a reduction of volume. Why? Because not all the cells take. And if we introduced a certain amount of fat, we know, or at least we say, like a thumb's rule, we say that about 40 to 50% of the volume that we have injected or actually transplanted will not take. So The end point will be a decrease in volume. It takes about 3 to 4 months to reach this endpoint volume. And then at that point, we will have to discuss with the patient about a second procedure if he wants or she wants more volume. So these things should be explained from the beginning, so there won't be any surprises. And most of the patients that have large volume introduction or reintroduction of fat, I'm telling them that they should take into consideration that we might do a second procedure. It might be needed.
Okay. Okay. Sorry, or the same thoughts exactly?
Yeah.
So another question regarding that the doctor has a Beautifill for 6 months. He has it at 6 months, and he wanted to know what powers of the laser are recommended at every stage of liposuction procedure. So if I'm
For the liposuction.
For this every stage of liposuction, yeah. So I guess you have answers for it's also changing, right? I mean.
I think it's for me it's a bit changing according to the area in the body. If it's abdomen, thighs, or so on the trunk, I usually, as Dr. Shapira said, I put it on the maximum 15, and I'm doing like liposuction freely. If there is a small area which I would like to contour, or to do something very special over there, or to create a smoothness of the skin, I usually take the energy down and also put a smaller cannula. So the smaller cannula, like in other liposuction, makes me work very meticulous or very gentle on this
More
area.
accurate.
Yeah, more accurate.
So more accurate and less trauma to the tissue?
Yeah.
Yeah.
And some if you want to have like the six-pack.
The high definition one?
Yeah, high definition for six-pack. You can use it also with the liposuction.
Yeah.
It makes a very, very good work in creating underneath the skin the shrinkage of this tract. You can do a six-pack with this, so we can put it on a higher energy rate, and it makes fantastic results.
So it's acceptable to change during the procedure the power settings depending the tissue that you want to address, the area that you want to treat.
And how much you want to shrink this tissue as well.
And change the cannulas themselves. So we have a variety of cannulas, 2, 3, and 4 millimeters in different length of the cannulas, and it's very easy to change the tips of the cannulas using the same handle itself, and you just adjust the length of the fiber, and it's very, so you learn it quite fast, and it's very smooth, and it doesn't take time to change the cannulas during the procedure. So it's very, very easy.
And we also have the physician guide, which actually shows the physician guide, of course, were written from your advices for us, because we had to have some protocols from doctors, and we're not deciding these by the wind just for people to be relaxed.
Yeah, reassured.
Absolutely. We're working with doctors, and everything is according to their knowledge and the force experience. Another question is, are there any comparison made with a water-assisted liposuction compared to viability or lipofilling? I think...
You're the expert in the vitality of the cells.
Another option to harvest high-yield fat cells is, like mentioned here, the water-assisted liposuction. I think it's a good method. The numbers that we have show that the vitality is a little bit higher with the lasers, but I'm not sure that it is that much of a difference. But for me, the main thing is that we don't treat only the fat when we use the laser, we treat also the skin when we use the laser. And I think this is the main advantage when I compare it to such an option which doesn't have the heating up of the tissue surrounding
the tightening effect.
So no tightening effect or less tightening effect. And from my point of view, this is the biggest advantage, that if I want to harvest fat to do a lipofilling, I'm sound that I will not cause damage in the area that we take the fat from.
All right.
I agree with him. The main advantage is where you take out the tissue.
Yeah.
I'm not sure regarding the percentage of the vitality, but it's a main advantage in any liposuction area.
Yep.
We can use, and also the mechanically
it makes it easier.
Much easier for me. And also the way we collect the fat, whether it's less water surrounded the tissue, it's a bit more easier for me.
So the difference is mainly for, as you see it, the advantages, of course, is the tightening, that the Beautifill has the tightening effect compared to the water, and a little bit higher, the higher viability in the end, and the time saving, of course, and it's more easier also to penetrate. These are the main key points that you're addressing.
Yeah.
So the last question, I promise.
Okay. Questions.
Is there any practical advice regarding the laser procedure in the phases of infiltration, suction, and tightening? So any specific advices from your experience that you can give the audience regarding the Beautifill procedure?
Make sure that we took out all the serum, all the fluids, cleaned the fat, and have only pure fat before you do it. Usually when we use the Beautifill system and we're taking out the fat, we can see it's a yellowish color. It's usually very, very, very pure fat and nice, mostly no blood. So to make sure that it is like this when we take it, bring it back.
So one advice, make sure that there is fat, specifically without any fluids.
Yeah.
It's good advice, actually. It is, because we see these sometimes that people do not want to wait and just, okay, so make sure that no fluids are left in the canister and it went all to the waste canister. That's a good advice, actually, doctor. I have to remind myself that when I'm talking to people. Dr. Shapira, any advices, maybe?
I think from the system point of view, Dr. Israeli said it all.
Absolutely.
And we should remember the general consideration. So create realistic expectation from the patient. Explain also the problems that might happen. Reassure them that you can address those problems if they will happen. And all in all, you should get those patients and those procedures that you and your patient will be happy with.
I agree with you all. I mean, I think it's amazing. So I had great time to host both of you here. And I think the audience, I was very excited and I got a lot of knowledge. And I'm sure that our audience gained as well. In any case, they are always welcome to address us. And maybe you with other questions. Of course, we will be happy to assist and help. As Einstein said once, creativity is contagious, so pass it on. And I'm so delighted that you did it. So you passed it on, and thank you again, and thanks the audience for having this time with us. So bye-bye from my part and from
Thank you very much.
Thank you all.
Bye-bye.
Thank you.
Thank you. Bye-bye.